that the NHS was under pressure before COVID struck us, changing demographics and ever-increasing expectations of what healthcare advances can deliver, which of course in themselves are positive developments, were posing challenges for the NHS and necessitating reforms to care pathways. That said, COVID, and I think we all know and understand this, represented a significant shock to the system. And its ongoing impact, together with associated backlogs, coupled with extraordinary levels of other illnesses this winter, is creating pressure that is truly unprecedented. In addition to COVID, the country has been experiencing extraordinary levels of winter flu. More than 1,000 patients were admitted to hospital with flu during each of the last 2 weeks. And finally, there has also been a rising number of cases of strep A and other respiratory viruses, resulting in a significant demand for services. So the impact of this combination of COVID, flu and strep A is clear in the statistics measuring demand for health services. If we look at the 2 4-day Christmas and New Year holiday periods, NHS 24 answered almost 100,000 calls. That's the highest number in more than a decade. In the final week of last year, compared to the week before, calls to NHS 24 increased by around 50%. The impact on the ambulance service has also been significant, compounded by longer turnaround times, which I'll come back to later. But the ambulance service responded to more than 16,000 emergency incidents in the past week, which is 11% higher than the average over the last 4-week period. Now, the impact of these initiatives shouldn't be underestimated, but despite them, the reality is hospitals right now are currently almost completely full. Last Wednesday, hospital bed occupancy across Scotland exceeded 95%. Now, for context, at the same stage in 2020, before the pandemic struck, occupancy was around 87%.